Hi, I'm Dr. Kim Brown from Wildwood Vision Specialists, and I wanted to talk about why we even care about myopia and why my child's vision is getting worse each year. A good place to start off is just with the basics. And what is myopia? Myopia occurs when the length of the eye is too long, or the corneal power, the front surface of the eye, is too strong. This causes light to focus in front of the back of the eye instead of right on the retina where we want it to. Myopia is on the rise. One in four parents have a child with myopia, which is about 14 million kids in the United States. This has nearly doubled since the 1990s. And by 2050, it is expected that 50% of the kids in the United States will have myopia. There are about four risk factors that contribute to myopia. Family history. If you, one or both of your parents wear glasses, are also nearsighted, you are more likely to become nearsighted. An increase in the use of screens. Everything we do now is up close. We've got our phones, we've got our computers, our tablets. There's lots of more studying and near work than there was before. And also, we're just going outside less and less. And so that lack of outdoor play contributes to the increase in nearsightedness. So why does it matter that you're getting worse and worse nearsightedness? Well, nearsightedness or myopia can contribute to a lot of different diseases. It can contribute to different myopic changes in the macula, where you get that center part of your vision, retina detachments, cataracts, and glaucoma. So if we keep those incidents of myopias lower, the risk of these diseases gets less as well. The benefits of keeping those prescriptions low is that are a better candidate for LASIK in the future. The lower cost of contact lenses, the greater the prescription, the more costly the contacts or the lenses in your glasses are, and better long-term health and vision overall throughout your lifetime. How do we manage myopia at Wildwood Vision? Well, there's a couple of things that we're going to do a little bit different than your typical eye exam. Your eye exam will definitely measure how well you're seeing. That's the 2400, 2200 measurements. We'll also use a measurement to measure how long your eyeball is. So we measure how, and compare how long your child's eyeball is to a typical eyeball at that age, which then lets us predict that if that myopia is going to get worse and worse each year. We also measure that front surface, the cornea, and we are able to look at that power and predict myopia progression as well. And then, of course, we'll do that typical one or two, which is better, and get the actual numbers of the prescription and see how myopic your child is. There's a new standard of care of myopia. So instead of just prescribing the glasses of what your nearsighted is, we now know that there are ways to decrease myopia progression from it getting worse and worse each year. And the studies show that there are a couple different ways that we can do that. There are soft multifocal contact lenses. Those are like a monthly replacement schedule. MiSight contact daily lenses. Orthokeratology or CRT lenses, those are the lenses you sleep in at nighttime. Myopia control glasses, however, those are not quite yet approved in the United States by the FDA. And low dose atropine drops you can use at nighttime. We'll go into more detail on each one of those options in our next video, but those are kind of just a brief overview of what myopia it is and why we care about it getting worse and worse each year. So what can you do today? You can schedule your eye exam and we can talk about your child's risk for progression. And we can also discover and create a personalized treatment plan for your child. Some things you can do right now is to start at home, is to limit your screen time. Work on the 20-20-20 rule, and that is every 20 minutes of near work, you take a 20-second break and look at something 20 feet away. And that just helps your eyes stop getting in that locked up close position. Those frequent breaks, and then also increasing your outdoor time. You want to spend at least 60 minutes outside every day, and that helps your eyes kind of relax from that all day focusing and promote less axial length growth. Of course, if you have any other questions or want to talk more about your myopia control options, just give us a call at 636-273-3910, or you can email Dr. Hayes or myself. We look forward to speaking with you.